Hi, this is Kathy from Medicare in Florida. It is Monday, October 6th, and I wanted to talk about the medicare.gov website that we can use to find information about the insurances that people need when they have Medicare. So you probably know that you have Medicare Part A, which is hospital, and Part B, which is your medical insurance that pays for 80% of medically necessary expenses at the doctors and labs and outpatient durable medical equipment. It pays 100% of preventative services like your colonoscopy and mammogram. But this is the time of year when people need to look at and make decisions about their Part D prescription drug insurance or their Medicare Advantage plan, which is their HMO or their PPO, or their Medigap supplement insurance. So to do that, you can go to www.medicare.gov, and at the top, you can click on Find Health and Drug Plans, or scroll all the way to the bottom, and you'll see a button that says Find Health and Drug Plans. On the right-hand side of the screen, then, you'll do a general search and enter in your zip code. If you are already on Medicare, you're welcome to create your own My Medicare account, and you can enter your password on the left-hand side, but right now I'm just going to be talking about doing a general search. So you put your zip code in, and then you click on next, and it will ask you, what are you looking for? Are you looking for Medicare Part D information, or Medicare Advantage plan information, or Medigap supplement information? And sometimes the Medicare website calls Advantage plans health plans. So they use those terms interchangeably, but what we're talking about are the type of insurance, which are the HMOs and the PPOs, POSs, special needs plans. They're those all-in-one plans. So let's say you're looking for a Part D drug plan, and you'd click on you're looking for Part D. The next screen that comes up will ask everybody if they have some sort of financial assistance to help pay for things. That could be Medicaid, it could be extra help, it could be the Medicare savings program. And if you have one of those, just indicate that. But if you don't, you can hit the radio dial that says, I don't have any help. The next screen will ask if you'd like to enter in your prescription medicine. And if you do take prescription medicine, I highly recommend putting the name of the drug in. Once you start typing, all the drugs spelled like that will pop up. So you highlight the name of your drug, and then you'll indicate the quantity and dose. So for example, if I'm taking one pill a day, that would be 30 a month. If I'm taking, let's say I get my drugs every 90 days, that would be 90 every 3 months. So you can put that correctly and then hit add to my drug list. And there you've got your first drug on the list. So you keep repeating that process to add all the drugs onto your list. And once you're done, you'll hit completed adding my drugs. I'm finished with my drug list, and it will take you to the next section, which is to add your pharmacy. So on the Medicare website, you can add up to 4 pharmacies plus mail order. And I do recommend putting a few in there just to see if the prices are different. Maybe they're less expensive at Publix versus Walmart, or, wherever. Once you enter your pharmacy, on the bottom, there's a blue ribbon which shows which pharmacies you've selected, and you can click next. And then you'll get the Part D plans available in your zip code, sorted from least expensive to most expensive. So what are you looking for? Well, you look at the least expensive, you're going to want to look at the monthly premium. And then I would click on the plan detail button to see what my copayment is going to be and if there's a deductible. So it'll show you the total copayment for each drug for the whole year. It will show you the payment by month, and so you can see how much you're gonna spend for your Medicare Part D. And starting October 15th, you'll see the enroll button. So if you hit enroll, it'll ask you for the information on your Medicare card, your Medicare number, your address, and that kind of thing. And then you hit enroll, and it'll start, if you do that, it'll start January 1st, 2026. What if you have your birthday now in the fall? If you have your birthday in October, November, and December, you can see the 2025 information first, because you can sign up for something in 2025 and then you'll have to redo the whole process and look for something in 2026. So a couple things I wanted to mention. I do see now in the plan detail of the Advantage plans at the top that it says how much money they will reimburse you towards your Medicare Part B premium. So that's a great new feature. And you can line up any Advantage plan or the Part D plan side by side, up to 3 at a time. So if you're looking at Advantage plans, ask your doctor, which Advantage plans are they going to take? And that'll narrow it down. So that's a great tool to use. And you have between October 15th and December 7th to make a change. So if you have any questions, put them in the chat box and I'll try to I'll try to answer them. Thank you and have a wonderful rest of your afternoon.